You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, Smile Makeover. According to my first guest, you could have the smile you've always wanted. She says that small improvements can make a big difference with your appearance, how you feel about yourself, and of course with your smile. With us we have Dr. Nikki Green. Dr. Green, welcome to the program.
Thank you, Randy. I'm so glad to be here.
All right, now before we get into today's topic, for those people that don't know you, tell us a little bit about your practice, who's a typical patient, and what do you spend most of your time doing?
All right, that's a great question, Randy. We have a general dental practice in Fort Worth, Texas, kind of on the west side of Fort Worth, kind of old Fort Worth. Our office, like I said, it is a general office with an emphasis on cosmetic dentistry and smile design.
You say you're underserved, by the way. Very interesting as far as cosmetic dentistry goes.
I really think we are, and that differs a little bit in Fort Worth, Texas, as opposed to Southern California. There's not a cosmetic dentist on every corner of the street, you know. There's a lot of great dentists in Fort Worth, absolutely, and there's a lot of people in Fort Worth who have been served by fantastic dentists.
So, but back to the original question, your typical patient. I mean, what are the procedures you do?
That's a good question. We really don't have a typical patient or even a typical procedure throughout the day. Our patients may consist of the retired grandmother or grandfather who maybe has an old loose-fitting denture that they've worn for years and they don't realize that it can be snapped onto a couple of implants. We've also got the soccer mom that, maybe has not liked, maybe she never went through braces and she's got crooked teeth and she's ready to do something about it. So she may be coming in for Invisalign. We've got the businessman who, type A personality, he's ground his teeth down, his teeth don't look as youthful as they did maybe 10 years ago. And he comes in and in a couple of visits we do a smile lift for him that gives him his
smile lift.
A smile lift, yeah. That's a conservative, maybe 6-8 veneers that you can come in and within a couple of appointments you have the points back to your teeth, you have the angles back to your teeth, the length back to your teeth maybe that you had 10 years ago.
And you say small things can make a big difference. You believe that?
Oh, absolutely. Small things as small as tooth whitening. I mean, that alone can make a big difference.
You say they look younger also.
White really? Teeth are younger, Randy.
Okay.
Absolutely. Everybody's teeth tend to absorb color as we age. We're all coffee drinkers. We all drink tea, red wine, all those things that we indulge in. All those things stain our teeth. And over time, it starts to tell how old you are. Sometimes prematurely. You know, there's some people who have prematurely old-looking teeth. So all those things contribute to an not so ideal smile.
Now this enthusiasm you like this.
I love it.
You're into it. Why is that? And what do you like most about what you do?
What I love most is, one, I deal with people all day long. What business do you not enjoy? Well, there's some people who don't enjoy dealing with people, but I love dealing with people. But what I love even more is making an impact in how someone feels about themselves. The makeup artist made me feel better about myself today.
Oh, is that right?
Absolutely. Okay. And so I feel like I can do the same thing by restoring a smile, whether it's a...
Are there a lot of people that really don't like their smile? And that have hated it for years?
Oh, I've got some pictures I'm going to show you of people who have gone for years hiding their smile, and they may not even realize that they hide their smile. They've done things to compensate for what they just thought they were born with ugly teeth.
What about in this economy? Do you find people wanting to invest in their smile?
More than ever, Randy.
Really? Okay.
More than ever, because I think in this economy, there's nothing better than investing in yourself. Nobody trusts putting money into the stock market or buying a new car or some of the electronics or maybe that we were all tempted by 5, 6, 7, 8 years ago. Today, there's no better investment than investing in yourself.
How important is the smile?
A smile to me is everything. It's it tells you a lot about a person's personality. Take a job interview, especially in this economy. There's lots of people out on job interviews that haven't been for years. And you've got 5 people lined up, and you've got 2 of them that have a beautiful smile that they're proud of.
Or at least they're smiling on the interview.
Or they're smiling, exactly. And then you've got someone else who won't smile, and maybe they won't smile because they don't like what they show.
So you hire the happy person.
So you smile the happy person.
With all things being equal.
Absolutely, everything else being equal.
Very, very interesting. Okay, and I know you have a lot of photos, and they're very dramatic photos, by the way. But we should talk about your practice. I mean, your practice, when you take a closer look, is not your typical practice?
It's really not. We focus a lot on the comfort of the patient. That's our primary focus. I want to give you a beautiful smile, Randy, but if I can't do that in a comfortable manner.
You have like heated pillows?
We have heated pillows. It goes back to that people don't want to be there. You know, we're in a very personal space. It's always been something that's been made fun of in the media as being archaic and hard and difficult. And so we will do anything that it takes, honestly, to make it a more comfortable experience for you. And we do that through heated neck wraps. We do that through TVs in the ceiling so that you can watch the wellness hour for the hour that you're there if you want to.
The only thing left good on TV.
Only thing left good on TV. So, you know, you can do that to make your mind off of what it is that we're doing. And then we have technology that makes it easier. You know, we have CEREC one-day crowns. So we've got people.
Is that right? So right there.
Absolutely.
So you don't have to send it to a lab.
Absolutely. Now, this is not for your smile design, Randy. Let me clarify, okay? Because in my opinion, for your smile design, you still need a master ceramist to be involved. But say, you know, you've got a broken tooth. You bit down on a popcorn kernel and you broke a molar. You've got an hour for lunch. You've got this broken tooth. You want it taken care of today. You can easily come into our office. We can take care of it during your lunch hour. You leave with the permanent restoration in place, which is very unlike dentistry used to be. So yeah, we have a lot of.
And you have a team of people. I mean, you have more than one dentist.
Oh, absolutely. We have a team of people, not only amongst the dentists, but also my team, my staff that's around me, who they're phenomenal. But we have a team of dentists. We have myself. I'm the primary dentist. I'm there every day. Okay. We've also got Dr. Bob Leedy, who comes in from Abilene. He provides specialty type services. He's a general dentist, but he comes in and places implants for us in office. Okay. That's huge, Randy. We don't have to send our patients all over town, you know, to have simple procedures done. He takes wisdom teeth out on our teenagers, you know, our young adults who need their wisdom teeth out on spring break. He's there to do that. We also have a new dentist in our office. Her name's Dr. Susan Milner. She comes from kind of the mid part of the Metroplex, and she's there primarily to do our restorative. She's excellent with composite fillings, the tooth colored fillings. She's excellent with posterior crowns, and she understands the CEREC machine and how to use that. And so she's there, and to be honest, she allows me she allows me time to focus on what it is that I feel.
Because you like the cosmetic part.
I do, Randy.
Now, what falls into the category of cosmetic dentistry?
There's a lot of things that fall into that category. Everything we do in our office is cosmetic, okay? I'm not going to put anything in a tooth that I wouldn't want in my own teeth, okay? And I have dentistry. You don't know it, but I do, because it's natural and it's cosmetic dentistry. But everything falls into that. A tooth-colored filling, where we take out an old silver or an old black filling that's in the back of someone's mouth. Is that popular,
by the way?
It's very popular. Do I do it? To give my philosophy a little bit, Randy, I'm not one who feels like we have to go in and take out every silver filling in someone's mouth. But if that's what someone wants, absolutely, we can do that in our practice. And when we restore that tooth, we restore it with a tooth-colored filling that looks good and looks like the tooth God gave you. You know?
Okay, all right. So other categories.
Other categories are tooth whitening. People come in, again, on their lunch hour. They come in for an hour, then an hour and a half, and they have the Zoom tooth whitening done, which a lot of people have heard of the Zoom tooth whitening. We can lighten people's shades 6, 7, 8 shades in that hour to an hour and a half. I just had a patient who did it last week, and I read her review over the weekend, and it said, "My only regret is I didn't do it sooner." You know, she was amazed with her results. She has a beautiful smile. The whitening just served to. She didn't need her teeth reshaped. She didn't need her teeth put in a new position. She just needed her smile brightened. So that's tooth whitening. We have Invisalign in our office. So maybe the soccer mom that never went through braces, maybe her parents couldn't put her through braces or didn't understand the importance of straightening her teeth.
So adults like
Invisalign.
And it's a lot less than veneers.
Absolutely. We're talking about similar cost to what it costs.
What about teen? Invisalign teen?
Invisalign teen is out there.
Pretty popular?
Yeah, it's very popular. And for the right candidate, for the right teenager, it's great. Other areas of cosmetic dentistry, we have people who have avoided the dentist, Randy, for upwards of 10, 15, 20 years.
Well, you brought some photos. And by the way, if you're just tuning in, we're talking about Smile Makeovers today with Fort Worth's cosmetic dentist, Dr. Nikki Green. And these photos really are dramatic.
They're very dramatic, Randy.
Very
This is where we're changing lives, Randy.
Okay, you were saying, I'm sorry, I interrupted.
No, someone who has not been to the dentist maybe 10, 15, even 20 years. Those people always come in, Randy, and say, I know you've never seen anything as bad as this.
Do they really say that?
Absolutely.
Is that your favorite kind? I mean, a complicated or?
I would have to say it's probably my favorite.
Is the people they think there's nothing can be done?
They think there's nothing that can be done. They're coming in, a lot of times they think they're headed to dentures because that's what their mom had or that's what their grandparents had, and that's what they think is still the last resort available in dentistry. And I love to be the bearer of good news. I love to tell them.
I mean, you could see their mouth and you say, boy, this is going to be good.
I see it.
Really?
I see it in the conversation. Yeah. When we're doing our initial...
How do you say it? Do you say, I'm going to tell you some good news here? What do you say?
Absolutely. Well, first I'll listen to them, Randy, because I want to know what it is that they want. You know, I want everyone to have a perfect smile. Not everyone wants that, Randy. And some people really just want me to address what their key issue is.
Okay, good.
And so first I'll listen to them. But the whole time they're talking, yeah, Randy, I am seeing the final result. Yeah, I'm seeing what's possible. And then I really just try to paint that picture for them.
Okay.
I do that a various number of ways. A lot of times I actually take their photos, just like we're going to look at photos in a minute. I pop their photos up on a screen and I show them what can be different about their own photos. Sometimes I'll go through my catalog of photos and I find people who look so much like them.
Yeah.
Again, that lets you as the patient know, yes, I have seen this before, you know, and I've probably seen worse. To me, I think it just gives a reassurance.
Now, you've had a lot of training. I mean, you teach other dentists the art of cosmetic dentistry. Is that right?
Yeah, I have. You know, really, Randy, in dental
is there
school.
that much to it, by the way?
Oh, Randy, there's a lot to it.
Okay.
There is. You really, in fact, that's what I would urge the listeners. Make sure if you're going in for a cosmetic dental consult, make sure you do look at photos. Make sure your dentist has an eye for this and has some continuing education in this particular
Interesting point.
field.
You say they have to have an eye for it.
They have to have an eye for it, yeah.
So it is artistic.
There is a huge artistic component. Now,
I feel like I could spot veneers walking, 10 yards away.
Those are bad veneers, Randy.
Okay. Not yours.
That's right. Those aren't our veneers. You don't want to spot veneers. You don't want someone's teeth to walk into the room 10 minutes ahead of them. You know, you just don't want that. That's a bad set of veneers. You want a smile design. I don't want to just go in and put porcelain on teeth. We can put porcelain on any teeth. But I want to start first by designing the smile. And that's the kind of thing that
So they have say-so in what their teeth are going to look like.
Absolutely, they have say-so. We talk a lot about shape. Of course, I will try to give my input because I have a trained eye, so I know what tooth shapes look more masculine. I know what tooth shapes look more feminine. I know what tooth shapes look good with certain architecture of the face.
Do they ever bring in celebrities?
Oh, absolutely. I get a lot of those.
I get
a lot of
pictures of me by any chance? They say I want this.
Randy, I'm sure it's going to happen next week after this show. I have no doubt.
But so they do bring in pictures, or maybe.
Absolutely, yeah. They'll bring in, clip art of someone that they're taking off the.
Right? Very interesting.
Yeah, and they'll tell me, I love the shape of her teeth, and a lot of times I try to say, okay, well let me tell you how this shape is going to look on you, okay? Because maybe they're bringing in a really square shape of a tooth, like Julia Roberts' teeth. They used to be, piano keys, straight across, square teeth, But maybe it's a really feminine woman, and I have to explain to someone possibly sometimes that a feminine look has a little bit more of a curve to it.
You mean the tooth itself?
The tooth itself.
Interesting.
Yeah, whereas men, you want sharp edges and you want nice, really pointed canines. That makes for a youthful appearance for a man, whereas for a woman, you want some more curves to the tooth,
Okay.
Women like their curves.
All right. And you say you're changing people's lives. You brought
Yes, I brought some photos.
Okay.
These are some of my patients. This first one is Dennis, okay? Dennis is your typical West Texas 50, middle-aged man who he's seen the dentist off and on through the years.
Right.
He's not your regular dental patient by any means. As you can see in that picture, he's had one crown done on those front teeth, This is a complicated example, Randy, of someone who has what we call a collapsed bite.
Is that unusual to see that, though? That looks pretty.
Randy, this is not unusual. It's probably unusual for you to see, okay? Because this same person with the mustache and the lower lip in his smile, he hides this, Randy, so you don't see it.
Interesting. Okay.
But absolutely, I see cases like this in my office.
So you just think they're
every day.
mad? They just never smile.
That's exactly right. You think this guy is
grumpy
unhappy
or
with
whatever.
life. You know, Randy, this guy has symptoms. I mean, with the wear that this guy exhibits on those front teeth particularly, he's sensitive to hot and cold. He has to be careful what he puts in his mouth. He has to drink things through a straw, you know, because he doesn't like for those hot and cold temperatures to hit those teeth. But when you see what we're going to do with his smile, this guy, you don't think this guy is grumpy anymore. You know, this guy.
So with even a person with bad gums like this,
oh, absolutely.
you can be a candidate for veneers.
Oh, absolutely. I mean, of course, getting the gums healthy is paramount. That's where the biology comes in, Randy. And if we ignore the biology, then we can put the most beautiful porcelain on there and it's not going to last. But absolutely, we have to take care of the biology, but there's nothing to say. I have people who come in all the time who think we can't fix their smile until we fix their gums because they've been told that. There's no reason, Randy, we can't do it at the same time.
Is that right? Okay.
Oh, absolutely. And particularly with the help of sedation dentistry. This guy in particular, he came in, we gave him a world-class smile, and we took care of his gum therapy in some of the same visits under sedation. We did all of that at once, Randy. But I want you to see a smile, okay?
All right.
This guy, you don't think he's grumpy
Very
anymore.
nice, very nice.
Okay?
Okay.
This guy's not grumpy. This guy loves...
He'll definitely be perceived differently.
Oh, absolutely. What's funny, Randy, is he did this right as he was retiring. You know, so he had owned a business. He had probably, you know, worked. You and I own businesses. We understand what this is like. Who has time to fix these teeth when you're doing this? But this was right as he was retiring. He came in. We restored his smile. He spends every day on the golf course now.
Okay.
I can promise you, he's smiling as he's out there. He's enjoying himself with his friends.
Is this the kind of thing where they say I should have done this years ago?
Oh, absolutely.
Like, what do they say?
Honestly, I have not had a situation like this where the patient didn't say that. Their only regret is that they did not do it sooner.
And what holds them back? I mean, that looks pretty dramatic, that before. It's pretty ugly. I mean, what?
Fear.
Just afraid of the dentist?
Fear is a big one. Time. I think that was more Dennis's issue. His was time. Like I said, he owned his own business.
But it doesn't take that much time if you're sedated,
but
right?
he thought it did. Okay. I want people to know that, Randy, that it doesn't take as much time, one, as it used to in the past, because we have technology, we have things like that that allow us to do treatment like this in shorter number of appointments.
Is it more men or women? I mean, who's coming in for this?
Oh, it's both. I've got pictures
Is it?
of, yeah, I've got pictures of both.
So more and more men are coming in?
Oh, I don't know that I don't treat 50-50, men and women.
Right?
Absolutely.
Mostly professionals or?
Mostly professionals, but not necessarily, Randy. Sometimes
like this walrus guy. Right?
Yeah, he's not a professional. Okay, let's go to this picture. You know, this is
that the best you could do on this shot?
That is the best I could do. That was him and his biggest smile. When you see the after smile on this guy, Randy, you're going to be blown away. But first, before we get to that, I'm going to show you something a little more detailed. And I know it's one of these pictures you don't like to see, but you have to see what this guy was hiding, okay? How old is this guy? I was going to ask you, how old do you think he is?
60s, 70s.
Mid-20s.
Really?
Randy, mid-20s, yeah. This is a tragic case, in my opinion. You know, this is someone who felt like he had been somewhat failed by dentistry. He had bad teeth probably the majority of his life. He's single, he's dating, or he wants to date. There's a lot of things going on in this guy's life.
Do they spill their guts, by the way, on these consults and say, Doc, I mean, it's just...
Oh, absolutely. And we allow for that, Randy. That's what I think sets us apart, is that we allow time for that. Sometimes our new patient appointments are an hour and a half, 2 hours long, because we allow time for you to tell us, what is it that you want to change? Why are you here? He wants a smile back, but let me tell you, he came in thinking he was going to dentures. And his mid-20s, Randy, he thought he was headed to dentures. Wow. Other dentists had told him that, I'm sure. You know, sometimes I think that dentistry, we use that as a scare tactic. You know, we see a young guy like this and we'll try to scare him into thinking that he needs to go to dentures, thinking that's going to make him. I said, Jeremy, I've got great news. Yeah. He did not.
You're proud of this work. I'm picking up on that. Good for you.
I'm very proud of it. We change people's lives. Okay, you haven't seen his after yet. So.
Okay, let's take a look.
There he is.
That's very nice. We got to put
Yeah.
that up on. It doesn't look like the same guy at all.
It's
especially
not
this walrus
It's
mustache.
not the same guy. That's the best news, Randy. Is
Okay.
it's not.
It's
You
not.
know, he's shaved that mustache. He doesn't have to have that mustache to
Well, you can't
hide.
see the rest of his face, but he looks like a good-looking guy.
Yeah, and how old do you think he is now?
Yeah, it looks,
Yeah, he
young.
looks like he's
Looks
in
like
his
a CEO of
mid-20s
a company
maybe.
or
Yeah,
something.
exactly. He's actually a rancher, you know. He spends a lot of time out on the farm, out on the ranch. But that doesn't mean those guys don't want to date.
What does he say? I mean, when he sees himself, is that emotional?
It's very emotional. You know, men sometimes are funny. They hide their emotions a little bit more.
Then they go to the car and they cry.
Then they go to the car. That's exactly right. Or they nearly have a wreck driving down the road
This
looking
is
at
really
themselves.
a good one. This is a good one. But
He's
is this
phenomenal.
common? I mean, I told you could only bring a certain amount of photos.
Right.
But, I mean, do you have a lot of people that
I
absolute transformation?
absolute huge transformations. The next photo I'm going to show you is not as big of a transformation, but I want to show you cosmetic dentistry, in my opinion, at its best.
Okay.
Okay. This is Beth. You know, a lot of people would argue that there's nothing wrong with her smile.
Not a bad smile.
But in her opinion, there was, Randy. And that's really all that matters, is that in her opinion, there was a lot wrong with her smile. She didn't like the color. She didn't like some of the crowding of her teeth. She wanted things brighter. She's in her mid-50s. She wants things brighter. She wants to have a reason to smile. This is her after, Randy. Now, mind you, teeth have to fit the person, okay? They have to fit the person's age. They have to fit the person's personality. Like I alluded to before, they have to be feminine on a female. They have to be masculine on a male. That's all in the eye of the dentist.
Okay.
The dentist and the lab technician, okay? You have to use master lab technicians. They can
Or else the teeth won't look real.
Absolutely. Lab technicians can make and break a veneer case for sure. Speaking of that, I want to show you, and I know you don't like to look at these.
Okay.
But
no, I just said they're pretty graphic.
I know.
And this one is graphic.
It is graphic.
But you wanted to show me this.
But
Why?
I want people to see that. Look at the gum line on the top front two teeth. Okay. Do you see how that tooth meets the gum line? You know, Randy, you told me that you think you can spot veneers a mile away.
20 yards at least.
Do those look like
No,
veneers?
they don't look like. I'll admit it. Okay.
I mean, really.
I'm trying not to side with you, but these photos are fantastic. So these are veneers, what I'm looking at.
Those are
Now,
absolutely
it seems like
veneers.
there's a dent. I mean, there's ridges in these teeth.
That's what you want. That's a
Okay.
master ceramist. A master ceramist
Make 'em look real.
puts anatomy in those teeth. They put translucency in those teeth. There's a color variation. They're not one color from top to bottom.
Now, you do, at the top of the show, you know, you teach other dentists cosmetic
Absolutely. Absolutely.
100 plus hours a year
Oh, absolutely.
learning this stuff. When you show me this up close, you're saying that not all dentists are doing it this way.
No.
Like you may have some unevenness of gums. or things like that.
Absolutely, Randy. I mean, we're all taught dentistry, okay? And dentistry, in its basic form, out of dental school, is drilling and filling teeth, placing crowns, gum therapy, the biology of dentistry. But the true art of dentistry, one, you have to have an eye for it. You have to be
Okay.
somewhat of an
Go to
artist.
somebody, right.
Somewhat of an artist. But then there's lots of continuing education that's available out there to really hone those skills.
Who would you like to see more of? Because you mentioned in the green room about the women with the, let's say, the Chanel bag, or they
Right.
care about their skin or Botox, and they have an older smile.
Right. I love all my patients, Randy, so I want someone who wants a beautiful smile.
Okay.
You know, if you want a beautiful smile, that's the patient I want, because I can give that to anybody. I can give that to the young person. I've got a picture in here of a 70-plus-year-old man.
Let's take a look.
Yeah, okay, I want to show you that one. I have a 70-plus-year-old man in here. This is Pete, you know. Pete was
Looks like
in
about a
his
70-something-year-old smile.
Absolutely it does. You know, and this is the smile he had lived with for many years.
So about 75 years old.
75 years
comes
old.
in, what does he
has
say?
missing teeth. He just thought he needed a lot of dentistry. That's what he came in thinking.
Okay.
You know, he came in saying, I need a lot of work. I don't know that he even knew that he could have an amazing smile, Randy. But
So again, you look at him on the console and you go,
look
oh
at
boy.
him and he's a slam dunk, you know. Now, mind you, there's a lot of dentistry that went on here. He had some implants placed. Dr. Leedy placed some implants on Pete.
Okay.
We did some porcelain veneers on Pete. He's got some bridge work in there. So there's a lot of dentistry involved, but I want you to see his after smile, Randy, and tell me if you still think he looks 75.
All right. Okay. Very nice. No, he doesn't. That's a good point. It's a nice, youthful smile.
And that's what I want, Randy. You asked me what I want in my typical patient. I want someone who comes in and wants a beautiful smile. And
it looks natural too.
Absolutely.
I mean, isn't that their fear, by the way? I mean, my fear would be, I don't know what it's going to look like.
Oh, I hear that all the time.
Big teeth.
Yeah, I hear that all the
These
time.
aren't big teeth.
Particularly, you know, when we mention veneers to a patient, oh, I have a friend who has those, you know, and that's everyone's fear, is that they're not going to look natural, that they're going to look boxy, that they're going to look like chiclets. I mean, I have heard every way to have veneers described. And again, that's why I show these pictures. And I show these pictures to every patient that comes in, these and many others.
Now, we are out of time. This is really good
Randy,
stuff.
do I have time for one more?
Okay, one more.
I've got to show you Bill, okay? Bill came in after probably 2 years. He's a priest in town, okay? He came in after about 2 years of some of his parishioners urging him to come see me. They were normal, they were regular patients of mine.
The people that go to the church and saying, you have to go see
Yes,
Dr.
absolutely,
Green.
absolutely.
Okay.
They were regular patients of mine. Every time they came in, every 6 months, they say, has Bill called? No, Bill hasn't called yet. Finally, after about 2 years of urging, Bill called, okay?
Now, he's okay with this, right? You showing these photos?
Oh, absolutely. He's very much okay with this. Very much okay with this. This is Bill. This was the biggest smile we could muster from Bill. Now, mind you, he's a priest. He's up in front of people. He's delivering messages on a weekly basis. He's in front of people. But Randy, the reason we couldn't get him to smile is this is what he was hiding.
Boy.
Okay? I mean, he had missing teeth in there. He had worn down teeth. He had teeth that hurt. Honestly, I think that's what finally got him in after 2 years, is he finally had some teeth that were hurting. Now, he was a combination, again, of a lot of dentistry, bridges, porcelain veneers, sedation dentistry. We did sedation on him, where he came in and had a lot of work performed in one visit, okay? He didn't have a lot of time. That was one of the things that kept him away. But you're going to be blown away by his smile, okay? When he was done.
Very nice.
Remember how he smiled in the first picture, Randy? Okay, we couldn't hardly get him to show any teeth, and that's how he smiled at the end. He's become a regular patient. He's in every 6 months. He's smiling as he walks in the door.
Okay.
He honestly says, Randy, that it's one of the best things he ever did for himself.
Really?
Absolutely, absolutely. He wishes he would have done it sooner.
Well, thank you for coming on the show. Good stuff.
Thank you, Randy. I've enjoyed it.
This is all on your website?
Everything. Our contact information is on our website. Our photos are on our website.
So if somebody watching this doesn't like their smile, what's their first move?
Go to our website.
Okay, good.
Contact us.
And meet with you one-on-one. Well,
Absolutely.
Thanks for coming on. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again, you could go to our website at wellnesshour.com, put in Dr. Green. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.